Hi, Dr. Mark here, and today we're talking about obesity. So, the United States is in the top 20 countries around the world when it comes to the percentage of obesity among adults. Both of our neighbor countries, Mexico and Canada, have lower obesity rates. Mexico is at 32%, Canada is at the 22%. We want to know why that actually is. So, let's first talk about the definition of obesity. First, obesity is a disease, and that is really important to understand. There's a lot of shame around this topic. And it is really important to understand that obesity is a disease, a complex and chronic disease, and a public health problem, not just in the United States, but in almost all countries around the world. So, obesity is defined as an excess amount of body fat that is unhealthy. But unhealthy is a very poorly defined thing, and the ability to really clearly measure body fat requires very specialized equipment. Even that is not 100% accurate. So you can imagine that most people really don't know exactly what their body fat levels are, and it is really hard to assess with weight and height. But it is a lot easier to assess with weight and height. This is why often the body mass index is used to separate overweight people and healthy people from obese people. And that means that often the body mass index has to be 30 or higher if you're obese, and 42% of all adults in the United States have a BMI that is 30 or more. Okay, let's talk a little bit about cost and reasons for obesity. So very simply cut, obesity is when you eat more calories than you burn. So that is when you get into an obese state if you do this for a long time. Often obese people also need more calories because they have a higher body mass. But just putting it as a problem of like diet itself is really oversimplifying this. There's a lot of reasons that can lead to obesity. But again, the increased caloric intake is one of the main reasons for obesity. Genetic predisposition plays certainly a role. Some individuals gain faster fat than others, and then therefore they're at a higher risk of becoming obese. But generally, there are two main reasons for obesity. One is an increased caloric intake over an extended amount of time, which means you eat a lot more calories than you burn, and that is often related to the quality of food. So you eat probably less nutritious food, a lot of fast food, and that over time can lead to increased caloric intake. A lot of those calories are coming from grains here in the United States. And then a second reason for obesity is also the reduced level of physical activity. So those two things really go a little bit together. It is, again, very complex, so that all can be affected by a ton of factors, like the lack of good quality sleep can affect whether or not you overeat, for example. Certain health conditions can impact your ability to either physically be active or directly affect your likelihood to become obese. As I already said, your genetics, you can have a genetic predisposition for obesity. And there are certain medicines that make you more likely to store fat. And then, of course, there are stress levels in your environment that relates to work and your family life, and all the other levels that increase stress level also are directly linked to obesity. So there's a lot of factors that affect obesity. Again, underlying is always an increased caloric intake, and you're eating more calories than you burn. But again, what can lead to this can be a lot of different factors that are directly linked to obesity. So why is the United States now so high in obesity? Again, it's not the highest, but it's pretty high up there. We are in the top 20 in the United States. And the question is why that is and what are the differences. So it's hard to put a trend on this as the main reason why Americans are more obese than others. And it was always not always the case. Back in the 70s and 80s, Americans' obesity was actually very low. We had a high population of non-obese people. That is not the case anymore. And so what a lot of change between the 80s and now is a lot of behavioral changes. Generally, Americans or US Americans cook a lot less at home. They eat a lot more out. That makes both portion size management but also nutrition management extremely difficult. Fast food is for many Americans still a big portion of their daily diet. We know that high fat and high carb foods like fast foods like burgers and fries, for example, can lead to obesity. The United States is less walkable. Most of the places cannot be walked very easily in the United States. That's the same with bike riding in the United States. So a lot has to be done by car, which again leads to less exercise and less physical activity. And as I said, work and life are often high stress environments in the United States, which also can lead directly to overeating and then therefore obesity. So I personally want to add also that I feel public education about obesity and the dangers of obesity are often overlooked or downplayed here in the United States. I think the good thing is that there's a lot of resources that you can address, but bad thing is there's a lot of shame around this issue, which I think it shouldn't be because it is a disease, and I want to explain a little bit later why you shouldn't be ashamed of that. So for me to explain this, I would like to compare it to another country that has recently been through a lot of growth and modernization, and that country is China. So physical activity as well as a more balanced diet have always been part of China's society, and Chinese diet often includes a lot of whole foods like fruit and vegetables, and also the extended use of public transportation and very walkable cities and towns, a lot safer city and towns, also helped to reduce China's obesity rates quite a bit. And until recently, China was one of the leanest countries in the world. But that is currently changing, and that is at an alarming rate as well. So reasons are similar to the obesity crisis that we have in the United States now for several decades, and also the culprits are pretty similar. So again, an overabundance of food combined with the convenience of less physical activity is leading to a health crisis that evolutionary wasn't there before. That doesn't mean that we should go back to the Stone Ages, but I think it is really important to understand that obesity is a disease complex that requires the reprogramming of very hardwired instincts. In a way, it is a large societal test, not just on individual changes, but also on a global scale, leading all the way from thinking about global food supplies and why some areas of the world starve to death, why other areas literally eat themselves to death. So it really has large implications. So evolutionary speaking, if we see food, we want to eat it. But in today's society, that is not a good idea. What is new for us evolutionary is like that we have to develop strategies of nutrition and calorie management and of physical activity management. Or in other words, like society in many places around the world have evolved to a place where we, for the first time in evolutionary history, don't need to have physical activity and we can eat all the food we want. Now we are at a point where we have to understand that we are forced to manage our diet and forced to manage our physical activity in order to avoid to becoming sick. In most of human evolution, that was rather not the case. So I really want you to understand this. So on an individual level, here's what we can do. The American Heart Society recommends 150 to 300 minutes of moderate activity per week of physical activity. That really depends a lot on your shape. Walking can be a very physical activity if you weigh 300 pounds. So you really want to be like in your space, but managing your physical activity, actively thinking about, okay, I have to walk today for 30 minutes and I have to do this every day to get to my 150 to 300 minutes per week. That itself is a big behavioral change. Again, evolutionary, we would never have to do this, but now we're in a place where we have to manage our physical activity in order to avoid becoming sick. Nutrition therapy is another thing. Change the diet to a healthy and balanced diet. Okay, that's also very important. That is what we're gonna focus here on our channel for the most part on. That can be a very long behavior modification, and it can take a lot of time to change your diet to a healthy and balanced diet. That goes hand in hand with your increase of physical activity. And then of course there's medical intervention, semaglutines and surgeries. I'm not a medical doctor, so I cannot talk about those too much. I just understand that they're not for everyone. This all can be summarized in like a behavior modification. And again, this feels unnatural for a lot of people because the natural evolutionary state for us is like to conserve our energy and eat what we have so that we can save it for later on. But in our society, that's not the case anymore. So we have to actively manage our nutrition and actively manage our physical activity to avoid becoming sick. One thing that I also want you to understand is that even with the right amount of physical activity, which is really important for the cardiovascular system, and you should do this, your diet is your main driver to lose body fat. The changes that you do to your diet will be the main driver to lose body fat. And I repeat this every time I do a video. There is no magic pill. you have to be caloric deficit. Semi-glutines help you to be in a caloric deficit because you feel less hungry. But at the end of the day, no matter how you get there, you have to be a caloric deficit. That is the way to lose weight. Physical activity can help you to achieve this, but the real weight loss happens with behavioral changes to what you eat and with changes in your kitchen. Focusing on this is very, very difficult and it will take a lot of time. And as I said, there's a lot of help out there. I put some links into this video and we're going to do a lot more of this content later on. Thanks for watching. I see you soon. I'm out.